Welcome back. We're keeping an eye on your health with registered nurse and health writer for the Post-Gazette, Abby Mackey. And I know this Sunday kicks off Pittsburgh Coffee Week. And Abby, you're here to talk about all things coffee. And you know, I think there's so much information out there, some good, some bad. So what is it?
Yeah, so preparing for Pittsburgh Coffee Week, I really looked at the research that's out there so far as caffeine and coffee and health. And there's so much. And what's interesting is it really gets into the mainstream because people want to talk about this. They love talking about their coffee, right? So they already know some of the benefits. They know that it can improve work performance, athletic performance, concentration. They also know that there are cardiovascular outcomes. It can lead to heart palpitations and things like that. But something that's less understood is the effect of caffeine and coffee on sleep, especially over time.
Wow. Okay, so does that affect all people who drink coffee?
So luckily, no. So there are some people who are safe. There are some people that have to be careful all the time. If you have a history of heart attack or stroke, you really need to be talking with your medical team about whether caffeine is ever good for you. But for the rest of us, there are healthy ways to do it. I spoke to Dr. Daniel Shade. He's a sleep expert at Allegheny Health Network. He said so long as we're keeping our intake below 150 or 200 milligrams a day, that's a safe way to do it. Also paying attention to timing. We should not be taking in caffeine within 8 hours of when we try to go to bed. Now think about that.
Wow.
If you go to bed at 11 o'clock, you can't have coffee past 3 p.m.
Wow.
Most people are not doing that.
Yeah.
But the people we're really focusing on with this story and with this concept are people who are trying to trade sleep for coffee. So I'm thinking about busy professionals, busy parents. They get to the end of the day, they think, I just have a few more things to do. I'm gonna have a cup of coffee at 9 p.m., 10 p.m., and that's where they get into trouble.
So what's so bad about, you know, how it affects your sleep? I don't know, short or long term?
Yeah, so we all have to admit that every once in a while we're gonna stay up later than we meant to. We might patch that with a cup of coffee. If you do that for a day or two, your body's gonna compensate for that. That's gonna be okay. But these people who trade caffeine for sleep over time, they're going to get into a chronic sleep deprivation situation. And we know that that can lead to increased risk of heart attack, stroke, high blood pressure, a whole bunch of things people would rather avoid.
Absolutely. All right, so if we still need to be awake or productive in the evening, what can we do instead?
Yeah, so Dr. Shade recommends 2 non-caffeine ways to naturally boost our energy. The first one is to get moving. So whether that's just a brisk walk down the street or a full-blown workout, you're going to activate your sympathetic nervous system. That's the same part of your nervous system that fires up during the fight or flight response. You're going to feel alert. The other idea is to take a nap, and I mean a short one. Less than 20 minutes. If you sleep longer than 20 minutes, you run the risk of feeling groggy, maybe even more tired than when you started. And the last thing is to maybe recalibrate the way you think about sleep in general. Don't view it as dispensable. It's just as important as your diet or exercise. And if you think about it that way, you're going to make lots of good decisions. But for most of us, we can participate in Pittsburgh Coffee Week and have a great time so long as we do it mindfully.
All right. I love my coffee. I love my sleep too, though. So thanks for all that info, Abby. All right. And you can read Abby's full story in the Pittsburgh Post-Gazette. It's in the UPMC Health and Wellness section. It'll be there this Sunday.